Michael, welcome. It's good to have you here. I want to begin by pointing out that you yourself contracted coronavirus. What were your symptoms? How sick were you? And what did you do to get well?
Well, thank you, Tyler. Kelly, thanks for having me on. So, yes, I contracted the virus. Unfortunately, I foolishly transmitted it to my wife and two of my sons. So we all tested positive. My symptoms early on were not the typical ones. I never really spiked a temperature. My fever, never had a high fever, never had a low fever. No real respiratory distress, a little bit of congestion in my throat. I did have some GI issues. What really struck me the most was extreme fatigue. And a lot of people are saying loss of smell and taste. I absolutely had that. And so there was probably 3 or 4 days there where I was just sleeping the majority of the day and night, my wife as well. And that was probably the lowest point.
You hear over and over exactly what you describe, and that is extraordinary levels of fatigue, sometimes accompanied by gastrointestinal symptoms. And you were never hospitalized, I take it. You were able to fight it out at home.
Correct. So one of the things that Holy Name has done since the onset of this is we rolled out a very robust, aggressive home telemonitoring program. So we don't just send people home and say, here's your test results and this is what you should do. And if it gets worse, come to the ER. We have nurse practitioners calling you 2-3 times a day, depending on your acuity level. And they did that with me and my family. And so twice a day, we would have to report our temps. We'd have to report our oxygen levels, our blood oxygen levels, our SpO2 levels. And if we got worse, they were going to bring us in. If we got better or we stabilized, they would keep us home. And we're doing that at the high point with over 1,500 people at home. So otherwise, those people would end up in the hospital and be an extreme drain on the already very limited resources.
So take us through some of the numbers that you have seen and are seeing now at Holy Name, which is a very prominent hospital in Bergen County. And finally, as you take us through the numbers, tell us whether you are beginning to see or sense a cresting of the wave in terms of hospital admissions or ICU requirements.
Great questions, Tyler. So we now have seen close to 3,000 people that we have tested. Over 1,500 of them are positive. As I said, over 1,000 of them are being treated at home. We had to increase our critical care ICU beds by a multiple of 6. So we typically would only have 20 ICU beds here. I now have 120. We normally would only have 10 negative pressure rooms within the hospital. I now have 250. So my facility crew here has done an incredible job. They're turning around 40-bed ICUs in 4 to 5 days, new construction. Absolutely amazing feat, but it proves it can be done. And what's nice about these new ICUs is they're all designed specifically to deal with this virus, to keep patients behind a plexiglass wall in a negative pressure area, and to keep staff, IV pumps, ventilators, monitors on the other safe side of the wall, so we're not burning through PPE the way others are. We're allowing one nurse to care much more efficiently, one nurse and physician and their team to care for a larger number of patients in a much more efficient and effective way. So that's helped us a lot. At the peak for us here, we were seeing anywhere between 150 to 200 people a day in our emergency room coming to our outdoor tent for testing. The good news is that has started to slow now. We're only seeing about 70 a day. So it's starting to slow down. A word of caution, we had not seen the wave of seniors that are in assisted living facilities and nursing homes. We know the virus is now present there. It's spreading very, very quickly. I'm very concerned we're going to see that next wave come in here a little bit. And so we're concerned about that. But we have absolutely all our predictive models. We have a very robust data science team. They've developed their own models. They're mirroring that on top of all the other national models that are being distributed. The curve has definitely flattened. It's come down. It doesn't mean the duration of this disease and treating it is going to get any shorter. The social distancing absolutely seems to be working, and we need to stay aggressive with that.
Right.
So we still have a few more weeks to go. but it absolutely is starting to work.
Well, you have just given us the best news we've had all day. And second best news is that you're healthy and your family is recovering. And the third best news is that your staff are bearing up well under incredible pressure.